Hi, good afternoon, everyone. I hope you're doing well. Welcome to our webinar, Strong School Wellness Policies, Best Practices, New Resources, and Tips for Illinois Schools and Districts. Today we will have two moderators for today's webinar. My name is Jana Simon. I'm a program director here at the Illinois Public Health Institute, and my colleague Sarah Chusad will also be moderating. Thanks, Sarah. So if you can go to the next slide, please. Before we get started, a little bit of housekeeping. With the webinar grid to your right, you will have an opportunity to put in your chat questions into the question or the chat boxes, and we will answer questions at the end of today's webinar. We have several great speakers lined up today, so we will save our questions for the end, but there will be time for Q&A. We have 90 minutes planned, but we may end a little early. And then next slide. So for this webinar today, it's being supported by a grant through the Illinois State Board of Education has received a funding through the Centers for Disease Control and Prevention called Improving Student Health and Academic Achievement through Nutrition, Physical Activity, and the Management of Chronic Conditions in Schools. And they will be partnering with the Illinois Department of Public Health and the Illinois Public Health Institute to promote nutrition, physical activity, and chronic disease management in Illinois schools over the next 5 years. So as you can see, in this grant's 5-year goal is to increase Illinois students' access to healthy food and beverages, enhance physical activity, and chronic disease case management in schools. And it is really focusing on professional development and technical assistance to increase skills of those trained to improve school health, as well as to actually increase percentage of schools promoting healthy environments. So next slide, please. So with this grant, this is the first of several webinars this year. It is a 5-year grant, so we will have a series of professional development technical assistance opportunities. We have webinars of these topics here on your screen planned for this year. We also will be starting a quarterly school health newsletter. So if you'd like to, everyone today will be added to that unless you opt out. And we will also be providing some targeted technical assistance to 4 local school districts in the state. Next slide. So today's webinar objectives, we really want to increase your understanding of the federal school wellness policy requirements, increase awareness of resources available to assist schools in developing and implementing strong wellness policies, improve knowledge on how to assess if a school wellness policy meets best practice standards, and then increase the understanding of the potential impacts of these wellness policies on student health, including access to healthy food and beverages, physical activity and chronic disease management, and also for meeting state and federal educational requirements. So those are our objectives. As I mentioned, we have a large line of great speakers ahead of us. And why is this important? Well, we know that increased physical activity is associated with improved academic, behavioral, and health outcomes in students. We know that students are consuming about half or more than half of their daily calories at school, and so options at school significantly can impact their weight and their health. And this work, improving physical activity, nutrition, and chronic disease management, can help lower the likelihood of developing chronic diseases into adulthood. From the Centers for Disease Control and Prevention, we know that a local school wellness policy is a written document that guides a school or school district's efforts to create supportive school nutrition and physical activity environments. And wellness policies can be integrated into the whole school, whole community, whole child model for school health, and they can help put several provisions into action from the Every Student Succeeds Act. So wellness policies can really help us with this work and guide this work, and we are here today to learn more about best practices. So without further ado, I'm going to make a note of all of our presenters, and then I'm going to turn it over to our first one. So first today will be Dr. Jamie Shrieky, who's a professor of health policy administration at the USC School of Public Health, among many other titles. And then we have from the Illinois State Board of Education, Beth Fitzsimmons, who will be talking about some of the wellness policy requirements. And then next slide, we have Marlene Schwartz, the director of the Rudd Center for Obesity and Food Policy, and Kate Yeager, director of state policy and advocacy at the Healthy Schools campaign. So go ahead to the next slide, and we're going to start out with Beth from the Illinois State Board of Education. And Beth, we're going to turn it over to you now.
Thank you, Jana. Like Jana said, my name is Beth Fitzsimmons. I'm a principal consultant with the State Board of Education's Nutrition Division, and today my piece is going to be covering the rules and regulations on local wellness policies. So this will include information about the final rule, including USDA requirements. I'll be sharing a few resources available through the USDA's Local Wellness Policy Toolkit, and I'll also be sharing some updates from ISBE related to local wellness policies. So to give a very brief background on local wellness policies, they were introduced in 2004 through the Child Nutrition and Special Supplemental Nutrition Program for Women, Infants, and Children Reauthorization Act. So quite a mouthful. Fast forward to 2010, and that's where the current local wellness policy regulations come from. The Healthy Hunger-Free Kids Act strengthened local wellness policy requirements set in 2004. And so the goal there was for schools to be in compliance with the requirements set forth in this act by June 30th of 2017. But diving into the actual requirements set by the Healthy Hunger-Free Kids Act of 2010, this next slide outlines the specific areas for which local education agencies must set goals. So this will include nutrition education and promotion, physical activity, and other school-based activities that promote wellness. When setting goals specific, could we actually go, thank you. When setting goals specific to these areas, local education agencies, or I'll probably start referring to them as LEAs, must review and consider evidence-based strategies. So for example, schools can look at the Smarter Lunchrooms movement when determining goals for nutrition promotion. And actually the USDA's Food and Nutrition Services expects schools to review the Smarter Lunchrooms tools and strategies at a minimum. I do want to mention that USDA FNS does not set a specific number of hours for nutrition education and physical activity. That question does seem to get asked a lot. Schools wonder if they need to set a goal for the number of hours spent on nutrition education and physical activity, and the answer is no. USDA FNS does not have that authority, but they do recommend that nutrition education be a part of the health education curriculum. And additionally, the CDC recommends 60 minutes of physical activity per day for children and adolescents. Local wellness policies are also required to include the standards and nutrition guidelines for all food and beverages sold to students on the school campus during the school day. So in other words, this part of a local wellness policy must be consistent with federal meal requirements and Smart Snacks in Schools standards. You can see on this slide, there's a picture of the Smart Snacks guide. This was recently updated to reflect some minor changes, which includes revisions to reflect the interim final rule for USDA child nutrition programs regarding flexibilities from milk, as well as FDA regulations pertaining to the Nutrition Facts Panel. Before moving on, I do want to elaborate on some terminology used on this slide because this can get a little tricky. The term school campus refers to any location on the school campus that is accessible to students, so this may not refer only to the food service area for some schools. This could apply to vending machines located outside the food service area that students have access to during the day, for example. And the term school day starts the midnight before to 30 minutes after the end of the school day. So just to clear up any confusion, because it does get a little bit sticky on those terms. Now, on the other hand, local wellness policies must also include standards for all food and beverages provided but not sold to students. So this includes things like food that would be brought in for classroom parties or used for rewards or incentives. Decisions on this policy should be made at the local level. Foods and beverages that are provided to students but not sold are actually not required to meet Smart Snack standards, but it is definitely considered a best practice and highly encouraged. This piece of the wellness policy also does not require schools to address food items brought from home for an individual student's consumption, like what a student might bring in their bagged lunch for their own consumption. Another requirement is that the wellness policy must include the district's policy for food and beverage marketing on the school campus during the school day. And that is that only food and beverage items that meet Smart Snack standards may be advertised. And by marketing, this includes any oral, written, or graphic statements made for the purpose of promoting the sale of a food or beverage item. So think about posters, flyers, cups for beverage dispensing, exteriors of vending machines, coolers, trash cans, that kind of thing. But on that note, I do want to mention that the intent of this particular rule is not to force schools to replace major pieces of equipment like coolers and scoreboards that are already in place, but schools should consider replacing items like these as necessary with equipment that follows the marketing regulations. So if a piece of equipment goes bad, then the next one that the school buys should follow these regulations. This policy does not apply to materials used for educational purposes in the classroom. So for example, teachers might use advertisements as an educational tool, but this rule would not limit them to use only advertisements for foods that meet Smart Snack standards. I do want to point out the posters I have pictured on this slide. They're examples of marketing that would be acceptable, and they come from Team Nutrition. The last local wellness policy regulation that I'm going to discuss covers public involvement, updates, leadership, and the wellness policy evaluation plan. A local education agency must permit participation by the general public and school community. So this can include people like parents, students, school food authority staff, teachers, school health professionals, school board members, school administrators, all those types of people, and more. So as far as the public updates go, the local education agency must make the wellness policy and any updates to that policy available to the public each year. As a best practice, it is good to share on the school's website through social media, newsletters, or by providing copies at something like a back to school night before the beginning of the year. The local education agency must also make the results of the triennial assessments and progress toward meeting the goals outlined in the policy available to the public. So on that note, schools are required to evaluate their wellness policy, and that's every 3 years. We call that the triennial assessment. And this assessment, I do want to mention, is different from the administrative review that would be completed by a State Board of Education monitor. The triennial assessment is completed by the LEA, and during that assessment, the local education agency should determine compliance with the local wellness policy, how the policy compares to model wellness policies, and should also measure progress made in attaining the goals of the wellness policy. So moving on to leadership, the LEA must establish wellness policy leadership of one or more LEA and/or school officials. So these officials would then have the authority and responsibility to ensure schools comply with the wellness policy. And the LEA does have discretion to determine who is best suited to play this role, whether it's a school nurse, a superintendent, a food service director. That's totally up to the district. And since I mentioned the administrative review earlier on the last slide, that would be completed, like I said, by a State Board of Education staff member. So I wanted to quickly discuss the documentation that an LEA should have available during one of those reviews. The district should have a copy of their current wellness policy, documentation of distribution of their policy and assessments made to the public. And the most recent triennial assessment should be available, as well as documentation of policy review and updates, including who was involved in that process and how the public was notified of their option to be involved in that process. So last on the agenda for this portion of the webinar is resources to assist you in developing your local wellness policy. So this slide specifically addresses the USDA Team Nutrition Local Wellness Policy Implementation Tools and Resources webpage. So this includes, among many other things, an outreach toolkit that has communication tools to help schools engage staff and parents in the local wellness policy process. It includes a popular events idea booklet, which has fun events to promote nutrition and physical activity. You can read about success stories from other schools in the CDC's putting local school wellness policies into action, which I've got pictured on the slide here. And it also includes a model wellness policy from Alliance for a Healthier Generation and posters to help schools promote healthy foods and beverages. This webpage includes many other tools and resources as well, so I do encourage you to check that out. I do also want to mention that the Illinois State Board of Education will be releasing a local wellness policy template for schools to use in the near future, which we're really excited about. Our goal is to have that out sometime in November. Additionally, if you need technical assistance regarding your school's local wellness policy, please give us a call. Local wellness policy questions can be directed to me, and once again, my name is Beth Fitzsimmons, and I have the number for the nutrition division listed here along with my email address. So before I hand it over to the next presenter, I did gather the links to a few helpful resources on this slide. These links will take you to the final rule and a summary of the final rule, as well as guidance, Q&As, and the USDA Team Nutrition Local Wellness Policy Implementation Tools and Resources page discussed a couple of slides ago. And on that note, that's all I've got for you, so thank you so much.
Great, thank you, Beth. So I just want to point out that for those of you looking for the slides, they are attached in the handout section on the in the webinar feature. So if you do the handouts and you click on the PDF right there, you'll have all the slides from today. So we do want to ask everyone a reflection question based on what you've just heard. A poll will pop up on your screen in just a moment. But how well is your school meeting the requirements for wellness policies? And so you can say really well, I'm confident we meet all the requirements. Pretty well, we meet most of the requirements. Somewhat well, we meet some of the requirements but could improve. Or not well, we don't meet most of the requirements. So we'd love to see where you fall. So go ahead and fill in that poll that just popped up onto your screen. Give everyone just a few more seconds to put in your answers. All right, why don't we go ahead and close the poll and we'll show the answers. Great, so it looks like most of you are in the middle, doing it fairly well, but a lower percentage of you are really confident that you're meeting all the requirements. So hopefully this will be a useful webinar for you as we go into the next section around best practices. So I will go ahead and turn it over to Dr. Jamie Shruki.
Thanks very much, Jana. Next slide, please. I'm going to talk a little bit about our National Wellness Policy Study that's been funded for the past decade or so from the Robert Wood Johnson Foundation and from the U.S. Department of Agriculture. It was originally, for some of you may have been familiar with our work under the Bridging the Gap project, and then we transitioned it into the National Wellness Policy Study. And here I acknowledge our study team. So today I'm going to talk briefly about what we know nationally about district wellness policies. Beth did a really nice job providing an overview of what's required in those policies and the required contents and elements, and I'll share with you data from our national study showing you where district policies stand. Although most of you, I believe, are from within the state of Illinois, we also have a companion study where we've been looking at state laws in this area across the country, and I'll talk a little bit about that, and a companion study that we have looking at district policies and state laws across the country on all elements related to the whole school, whole community, whole child model, which I'll also briefly touch on in a few minutes. And then I'll wrap up, back one slide, then I'll wrap up with some qualitative insights that we've gained from a series of focus groups and key informant interviews that we've done with a variety of stakeholders related to school wellness over the past 3 years as part of our USDA study. Next slide. Next slide. So our last national report that we issued on wellness policies across the country was for the 2014-15 school year. I provide the URL here on this slide, and as Jana mentioned, you can download these slides, so you can just click on that link and go to our report. It provides really nice nationwide data for each component of the required wellness policies to sort of show you where districts stand across the country, and it'll give you a nice sense as to if you had your own data as to where you stood relative to the national data. We're in the process of updating this right now for school year 2017 to 18, and I'll talk about that in a little bit. Next slide. So for our national study, we actually compiled hard copies or electronic copies for the most part of on-the-books wellness policies, superintendent regulations, guidelines, standards, things like that for a nationally representative sample of LEAs across the country. They included pretty much everything under the sun. We also incorporated state laws when they were incorporated by reference and model policies when they were incorporated by reference. Next slide. We covered all the categories of the wellness policies that Beth mentioned, and we added a few things. Because, as many of you know, a lot of the policies are written separately for physical activity. They have a separate section on physical activity and physical education, or you often have a separate physical education policy. We broke those categories out. We also had separate sections related to communication and stakeholder input, reporting, and historically there have been some policies out there that focus on staff wellness and role modeling, and even though that's not a required element of the policies, we have been examining those issues over time as well. Our competitive food and beverage category we've looked at, that's the smart snacks categories. We have a lot of provisions that we look at there because for each location of sale, so for vending machines, school stores, a la carte lines in the cafeteria, classroom parties, not sold obviously, and fundraisers in school, we code for a variety of different nutrient standards and food and beverage standards within each of those locations. So we look at a lot of things related to smart snacks related provisions. Next slide. So, and I can tell you that for the most part from what we've seen over the years, most wellness policies don't change very frequently. That's part of the reason when USDA devised the final rule, they had consulted with us and used our data to inform the rule regarding the triennial assessment, because from our data over time where we looked at data every single year from 2006-07 through current, we were generally seeing that for the most part policies were only being reviewed and revised somewhat every 3 years, and so that helped to inform that provision in the USDA final rule. So although these data are from 14-15, I don't expect that they'd be holistically different if we had data as of today. What I can tell you, and this has been true for a number of years now, most districts, like many of you probably, have a wellness policy on the books, which is great. You absolutely, that's great. I can also tell you that most of the wellness policies that are out there have some type of goal related to nutrition education, physical activity, and physical education, even though PE is not specifically required. Most of the policies out there explicitly refer to the federal school meal guidelines and have implementation evaluation plans. As of 2014-15, right when Smart Snacks were starting, fewer districts actually specifically had specific standards governing competitive foods or smart snacks in schools, but that number's been increasing over time. Overall, once you account for those competitive food standards, about a little more than half of the districts include all the required elements. But as you can see from this slide, the vast majority included your typical ones related to nutrition, physical activity, and school meals, and the implementation and evaluation. Next slide. In terms of smart snacks, these data were from the first year that smart snacks was required to be implemented in schools. And what was really interesting about the data is we looked at the percentage of district policies for the nationwide sample with nutrition standards that met smart snacks at the elementary level, and then on the right-hand side for the middle and high school level. So about 1/3 of the policies, a little more than 1/3 of the policies actually met smart snacks for both the elementary and middle and high school levels. At the elementary level, we often sometimes we would see districts that actually outright ban the sale or service of foods outside of the meal program for elementary schools, so we would see a ban in that area. A lot of other districts, for the most part, are just simply referencing to existing state standards that meet smart snacks or to the federal law, rather than embedding the language of smart snacks directly into their policy. Next slide. Marking and nutrition, Beth mentioned that that was one of the new provisions in the final rule. And at 2014-15, before the final rule came out, we anticipated that this was going to be one of the areas that was probably going to show up in the final rule. So at that time, the few districts that actually address marketing tended to talk about promotion of healthy options. So maybe presenting the food pyramid or you know, a poster like the teen nutrition posters and things like that. And less districts had in their policies explicitly a ban on marketing at that time. Although now with the final rule, there are definitive requirements that marketing for food and beverages must meet the Smart Snack standards, as Beth mentioned. So that is one area that we actually will have data on going forth to share with you. And we also will be in position to share some model language from other district policies if you're looking for that. Next slide. As Beth mentioned, parties and food groups reward those things that are not sold but are served. Although they are not required as part of the regulation, it is an area where a lot of districts have actually taken action. In most cases, the districts tend to recommend that food served in classroom parties, for example, be healthy options, or they recommend non-food related parties. What's really interesting about the classroom party issue in particular is we did a study where we linked our wellness policy data with school practices from across the country and the schools located in the districts where we compiled the district data. And what we found was schools were more likely to have party restrictions in the school if the district policy at least recommended some type of restriction. And when we delved into that a little bit deeper with schools through some qualitative work, we came to realize that the schools really felt like the policy recommendation at least provided them with some type of backdrop or at least some sort of basis for some decision making they may want to make at the building level to enable those schools that want to go forth with encouraging only healthy options or non-food related parties. At least they had some language in their policy that teachers and administrators could turn to if they were asked about it and push back. Food as a reward is less commonly addressed, but we find the same thing here where schools that are located in districts that recommend restricting food as a reward for either positive behavior or academic achievement or something like that, those schools are less likely to offer food as a reward if the policy even just recommends it. It doesn't require a requirement, which is usually where the pushback comes, particularly from PTOs and PTAs. Next slide. So Marlene's going to talk a little bit about the WellSAT tool, but one of the things that we've done, and holistically many people who've studied wellness policies across the country have done over time, is really look at the nature and extent of the components of the wellness policies across the required categories and some additional ones we've looked at, and the extent to which those things are actually definitively required. So on this slide, when I'm talking about comprehensiveness, it's really of all the items that we evaluated related to school meals or nutrition education, and nutrition education, we looked at 7 of them. About 54% or so were addressed in the policies, but only 35% of them actually were definitively required. And so that's pretty much a common theme that you'll see across wellness policies, and this is very typical across the country. It's not typical for one state over another, it's nationwide. Generally, most wellness policies address a lot of things, as Beth illustrated with the final rule. The law itself doesn't have a lot of definitive requirements. It requires that the districts put forth goals for a lot of things, and so that's what most policies do. There are districts, the ones that are marked in the red here, that go further beyond just recommending things or suggesting things to actually definitively requiring specific standards. So as Beth mentioned, there is no federal requirement for a specific number of nutrition education hours or physical activity hours, but a number of districts have gone to that level, or of course they're following their state law that often incorporates those types of standards. One thing, one thing I do want to point out here, Sarah, if you could just point to the implementation evaluation row there. One thing that I want to point out is that what we've often found over time is that the district policies tend to be strongest relative to addressing a lot of things related to implementation, evaluation, and reporting, and having definitive requirements for those things, but the policies themselves are not definitively requiring a whole lot. So basically, you're requiring evaluation and implementation of policies that I don't want to call them weak, but they're more policies that encourage things rather than definitively require things. Just something to think about as you go forward. Next slide. Actually, sorry, I forgot I thought I had one other slide in there. So one thing I do want to mention, go back one slide, Sarah, thank you, is on the reporting. One of the things that Beth mentioned is about sort of the requirements for the districts and then additional requirements districts may have for schools to report up to the district and then ultimately up to the state. We find a variety of different strategies that districts will take in terms of what they're requiring to be reported. And a lot of that information comes down from the state level. So as ISB starts to issue their guidance, I'm sure they'll be providing more information on that. But in our report itself, you'll find a lot of examples of the different types of implementation, evaluation, and reporting provisions that districts often include. Some districts will require as part of their wellness policy that districts, for example, report on school meal program participation or the nutritional quality of meals, reporting on physical activity or physical education time, results of fitness testing, things like that. So there's a variety of different strategies that districts have taken relative to reporting and monitoring of wellness policy implementation in addition to the process level or meeting the specific goals. So if you're interested in looking at some of those provisions, take a look at our report. We have a number of tables throughout the report that will guide you to what districts are doing across the country. And we have a number of different case studies as well. Next slide. Next slide. So now I'm just going to quickly talk a little bit about states, and I'm going to quickly rush through this because I know you are primarily located in the state of Illinois, and ISB is doing a great job with putting together guidance and other documents for you. But I just wanted to share with you, for those of you who are interested, sort of why state law matters in this area. As I mentioned earlier, a lot of district policies tend to incorporate by reference or embed into their district policy, state laws or state model policies. The one thing I do ask, I know Beth mentioned that the state's developing a model wellness policy, which is fantastic. I can tell you we've looked at thousands of district wellness policies across the country. The one plea that I will make with all of you if you are involved in your district wellness policy development is make sure that you contextualize the policy for your specific district situation. We've actually obtained district policies from districts across the country. I won't name which states they're in, they're not Illinois, where the district policy still is the fill in the blanks from the model wellness policy that was developed by their state board of education. So please pay attention to that. Recognize, in the model policy, I know in the state we have a lot of different size and shapes of school districts in the state, and so there'll be some elements of the model policy that'll work well for you and some elements that you might need to adapt and work with the State Board of Education on as you move forward. But the one rule I would recommend is just don't simply rubber stamp adopt the model wellness policy, because we tend to find that those that do that tend to be less likely to implement them. Next slide. So Beth briefly mentioned this, and I think Jana did as well, the whole school, whole community, whole child model. And the reason why I wanted to bring this up is not only are we looking at district policies and state laws across the country using this framework now, it really is an extension of wellness policies. And for those of you who are familiar with the old CDC coordinated school health model, the WSCC model is basically the coordinated school health model. It just took two of the elements in coordinated school health and broke them out into 2 additional areas, so it's now 10 components instead of 8. And it really has an emphasis on sort of the interconnectedness of these elements rather than thinking about the school as a siloed way of thinking. So physical environment, physical activity, physical education, nutrition, environment, and services, and health education are all core elements of WSCC, which overlap with the wellness policy. So for any of you that are really thinking more in a whole school, whole child, whole community framework nowadays, wellness fits really nicely into the WSCC framework. And then, of course, you have the additional elements. Just as a teaser, and I don't know if I'll be invited back in the future to share on these webinars in the future, but we are looking at wellness policies WSCC-related policies for over nearly 400 districts across the country currently, and all the concomitant state laws for all 50 states and DC. So just a teaser in the future, if you're interested in that, we'll be able to share that information. Go next slide, please. So just to point out a few things for you, most states thus far, and I would imagine districts too at this point, as we're compiling that data, really are still, if they had coordinated school health built into their standards, they still tend to use that language, and CDC has told me they are okay with that. If it's codified into an ordinance or into a district policy or a state law, it's a lot harder to change that than if it's just sort of a matter of practice. So most states, for the most part, are not specifically mentioning by name WISC or coordinated school health, but when they do, they tend to still have coordinated school health in there. And I think that's fine because, as I said, it really overlaps well with WISC. It just breaks out the 8 categories into 10. Prior slide. Thank you. Wellness policy leadership and adoption wellness policies and wellness councils. One strategy that a lot of districts have taken for implementation, and I'll talk about this in a few minutes, relates to specifically identifying stakeholders responsible for overseeing implementation and evaluation. Some states require that. Some districts have just built that in. As part of the new requirements out of the final rule, obviously you have to do some of that in your wellness policy itself. Next slide. And then I just had here some WISC-related items that I'm going to skip over for health education just in the interest of time. Next slide, Sarah. And then this was just showing you some state law data, looking across a variety of nutrition-related standards and the extent to which states are or are not meeting the federal requirements in terms of smart snacks and water at lunch and restricting marketing and food service training. As you can see, and most states are at least addressing smart snacks, if not definitively requiring them. The requirement's not on the state level, it's on the district level, so that's to be expected. Next slide. And then this is just some additional things related to physical education and physical activity. We do know that most of the standards governing PA and PE tend to come down from the state level down to districts. And so what most districts do is they tend to embed the state standards into their wellness policy in this area. Next slide. Although the one thing that is locally controlled tends to be more the physical activity related items related to recess in particular. Next slide. If you all can just prompt me and tell me how many minutes I have left, that would be really helpful. So now I just want to briefly share with you some of our qualitative findings, because I think I only have a few minutes left, if that. One of the things we wanted to do, and USDA was interested in, was really learning more about sort of what are some of the experiences that stakeholders have had with wellness policies. And so we really focused in on what are some of the lessons learned and challenges, their awareness and engagement, and then we also asked about recently about fundraising and marketing and things like that. Next slide. So I'm going to quickly run through, actually skip over these food service director and high school student ones because they're specific to meals. So if you can keep going a few slides, Sarah, let's stop right here. Thank you, superintendents. Oh. So we did a series of focus group and key informant interviews with superintendents who attended the American School Superintendents Association meeting. And basically what they found was that implementation and acceptance of wellness policies has improved over time. They said had we done this interview with them and focus groups with them several years ago, they probably would have been less likely to be able to say that, but they feel like now that it's more institutionalized and people at least know what they mean. And so they tend to be more likely to be willing to implement and accept. And now with the federal requirements for reporting and leadership, there is more focus on this. Interestingly enough, and I don't know if any of you are experiencing this, but one thing we heard quite a bit about from the superintendents is they often, when we ask them about what school wellness means, they often thought we were talking about staff wellness because they're so focused on the bottom line and some of the challenges that they face with their budgets and how staff wellness impacts their readiness to work and their productivity and attendance and things like that. Another area that superintendents have expressed a lot of interest in that has not yet been incorporated into wellness policies, but we are seeing more in that broader context of WISC, is social emotional learning. This is not a required element of wellness policies, but it is something that we are seeing a lot of districts add more language to their wellness policies related to SEL because of how intertwined social emotional learning is with student health and wellness overall. We also heard a lot about the importance of partnerships with outside organizations to help with implementation. So a lot of districts have partnered with local advocacy organizations, local grant organizations and community-based organizations to help them with implementation, providing technical assistance and guidance, and even helping with providing examples and stakeholder groups to work with. There were a lot of concerns expressed about food and beverage marketing, as I'm sure many of you experienced, and I can talk a little bit about that in a minute. And then the biggest challenge that districts face, and Beth, hopefully this is something you'll be able to provide TA to the Illinois districts on, is really about evaluation reporting. The districts don't tend to have a lot of processes in place to really help to facilitate evaluation reporting relative to wellness policies. And so any tools that you can provide beyond what USDA has provided, I think will be incredibly helpful for them. Next slide. And then USDA wanted us to actually speak with parents of middle schoolers relative to wellness policy implementation. Why did they want us to speak with parents of middle schoolers? They felt like that was a neglected population. So much attention is paid to the elementary school kids, and I think there's a general consensus that by the time you get to high school, if it already hasn't been dealt with and implemented, chances of implementation are going to be a lot lower. So they wanted to hear more about that middle years, the middle school level. And so they want, and particularly since parents are less engaged at the middle school than they are at the elementary school, they wanted to learn more about how are parents engaging in wellness policy activities at the middle school level. As I've already indicated, parent engagement tends to drop for a variety of reasons, but what parents did say to us is it really takes some detective work to initiate engagement in wellness. It takes patience and it takes persistence, and it really takes a strong champion to really help to advocate for these efforts at the middle school level, because as students are moving from the elementary level to the middle school level, they tend to have a lot more leeway in their lives in general, and are a better position to be making their own decisions, and schools tend to have a little more flexibility available for them, like in the food environment and elsewhere. So engaging parents in this process at the middle school level will help with the continuum of some of the strong wellness policy implementation provisions that typically occur at the elementary school level. One thing we did hear is that the PTAs and PTOs played a very strong role at the middle school level. And so when the Wellness Committee can work with the PTA and PTO, it really helped to get buy-in and really help with educating parents on the importance of these initiatives. Next slide. Recommendations from parents. These were straight out of parents' words. Find strength in numbers. So if you have a wellness committee, if the wellness committee is working with the PTA or PTO, the more parents you can get engaged and involved in the process, the more likely you are to be heard and taken seriously, and implementation is more likely to occur. And then if you're at the school district level, really figuring out ways to engage the parents as part of those wellness councils, and linking the PTA and the wellness council so that they're working concurrently and working together in a common frame rather than competing against each other. Because we know the PTAs and PTOs, speaking as a parent of now a high schooler, but speaking as a parent of a child who went through public schools here in Illinois, I do know that the PTAs and PTOs are often focused on the fundraising issues, and sometimes that can fly in the face of some of the wellness issues. And so finding ways to work together collaboratively will really help. The other thing that was important that parents mentioned is it's really important to hold these meetings after the working hours. Most of the parents of middle schoolers, a lot of them tend to work, and they often couldn't make meetings. And so if the wellness meetings or the PTA meetings are held during the day, it's very hard to get parent engagement. And so the more you can do to accommodate parents after school hours and work hours, the more likely they will be to participate. Next slide. And then these are just some resources available on our wellness policy website. We have a variety of data there on smart sacks and fundraisers. We have a series of briefs. We're actually about to post our superintendent materials, and forthcoming will be all of our parent reports and briefs. The briefs are written in a peer-to-peer format, so they'll be a lot easier to read. We also have the full reports available there as well. So I'm sorry I went a little bit over, but hopefully you found this useful.
Great, thank you, Jamie. All right, so we do have a reflection question to bring everyone to the chat feature of the webinar. We'd love for you to take 1 minute to type into the box, how has your implementation of your local wellness policy changed over time? Is it easier now? Are there challenges? Just take a minute to briefly reflect on your experience with your local wellness policy over time. And we'll give you a minute to do that. Anyone? I know someone wants to share. All right, well, we would encourage you to think about the data that Dr. Shirky just shared and think about how your own implementation has gone, and think about perhaps challenges you want to address, and we can maybe provide some technical assistance in future webinars on those topics. So let's go to the next slide. We now have Dr. Marlene Schwartz, who will present about measuring school practices and wellness policies and how to know if your wellness policy is a good one. So Marlene, I'll turn it over to you.
Thank you. So I'm happy to be here presenting with all of you. Next slide. Today, I'm going to talk about three different topics. One is the School Health Index, which I imagine many of you are familiar with. The second is the Rudd Center's Wellness School Assessment Tool. We call it the WellSAT. And then third, just a sort of brief idea of a strategy that you guys can use to use measurement to support positive changes over time. Next slide. So here are the links for both the CDC School Health Index and also the WellSAT. So I wanted to make sure you had those. So the School Health Index is an online self-assessment and planning tool. And really the purpose of this is to give the school and the people at the school a chance to really identify the strengths and weaknesses of the health and safety programs and policies that you have, and then develop an action plan to improve student health. And that can be incorporated into the school improvement plan. The other way that this really works is it's a process. It's a process that allows you to engage teachers, parents, and students into promoting the health enhancing behaviors. So it's interesting because it isn't so much about the score as about the process that you go through to really get the information and think through what sorts of things you want to focus on in your school. Next. So the School Health Index, or SHE as it's often called, has actually been around for quite a long time and has been updated. And the most recent update in 2017 reflects the WSCC model. So it was broadened to those 10 components, as Jamie mentioned. And there is an online course available on the CDC website, and I have the link here that really gives a lot of detail on how to use the School Health Index. One thing to note is that it's not a research or an evaluation tool. So it really isn't something that could be used to collect sort of numerical or quantitative data to assess the implementation of your policy. So it definitely shouldn't be used as like auditing or, you know, sort of making people feel bad about something that's not being done. It's really about creating this improvement plan to monitor your progress. And also, just to mention, it's done at the school level as opposed to the school district level, which makes it a little bit different than the policies, which tend to be at the school district level. And there are two versions. There's an elementary school version and a middle and high school version. Next. So now I'll talk about the WellSAT. Next slide. So back, as we heard, when the original requirement came down as part of the WIC reauthorization to require school wellness policies back in 2006, a lot of researchers were really interested in the impact of these policies and whether or not they would make measurable changes in the school environment. But in order to assess that, we needed to be able to quantitatively score those policies. So back in 2005, the Robert Wood Johnson Foundation's Healthy Eating Research Program had funded a few different studies to look at sort of people in different states, to look at the policies in their state and try to understand what, you know, sort of what they looked like and how they might be related to what was happening in the schools. And so we formed a team of grantees at that point to develop a coding measure so that we would all be measuring wellness policies the same way. Next. So we went ahead and published this, and this is the article, but the researchers were from Connecticut, Pennsylvania, Washington, and Minnesota. And we went through this sort of long process of collecting model policies, of looking at a lot of the materials that were already out there for school districts to use and really made this incredibly long list of all the sorts of things that could be in policies, went through and tried to organize it, and then tried to really select those things that we felt like there was some evidence to support. And we actually, at that point, ended up with 96 different items that were in the measure that our group used and published, and then also used in the studies that we did with that. Next slide. So 96 items was a lot of items. And so we knew that if there were school districts that wanted to measure their policies, that was probably not going to be terribly feasible. So Robert Wood Johnson actually encouraged us to create a simpler tool and to actually put it online so that people could easily access it and not have to go look up an academic journal article. So that's how WellSAT began. And we had 50 items. So we broadened our sort of committee evaluating the item beyond just the researchers to include people from state and federal government, as well as national advocacy groups. And so the idea was to really get at the things that were going to be most important to the people who were writing and implementing these policies. And we have updated that tool now twice. So there was original WellSAT, there was WellSAT 2.0, and now we're ready to release WellSAT 3.0. Next slide. So this is kind of a little timeline of how the WellSAT's been updated and how it's responded to the changes in the federal regulation. Next slide. So this is the 2.0 website, and you can see that there's a place for you to sign in, and then it basically walks you through all of the items, asking you the question, and then giving you a chance to score. And just to actually, can you go to the next slide? So these are the different components. And these are each treated as subscale. So as you can see, nutrition education, standards for the child nutrition programs, standards for competitive foods, and that's where you'd also get into the foods that are served and not sold, so the parties and things like that. Physical education and physical activity, wellness promotion and marketing, and implementation, evaluation, and communication. So we try to kind of organize the questions in kind of a logical manner that hopefully will be similar to the way that it's organized in the actual policy. Next. And so each item is scored on 3 levels, basically a 0. So these are, you'll see this is similar to the graphs that Jamie was presenting. They're sort of the bar graphs you would see, not addressed. So those would be the items that got a 0. A 1 is if the item is addressed, but it's in this sort of vague, suggested, or unclear manner. So here really the idea was we wanted to sort of recognize when a district was putting an idea out there, like for example, saying, we recommend healthy foods be sold, healthy foods are available at parties. That might be 1. And so it's there, but it isn't necessarily like a strong required policy. And then a 2 is when the item is in there and it specifically is very clear and specific and says this is, the requirement in our district. Next slide. So here's an example of what you might see. So the one item looks at food not being used as a reward. So if it's not mentioned, actually, sorry, I just realized, or only allows healthy food to be used as a reward, so that would be a 0. If they discourage using food as a reward, that would be a 1. And if they prohibit using food as a reward, that would be a 2. So in general, you end up with these overall scores where you look at the comprehensiveness, which is essentially how many of the topics does the policy address. So that's just going to be a percentage of the items that score either a 1 or a 2. And then you also can have a separate score for the strength. So that is the percentage of the topics that have that 2 score, so that required practice. Next. So we put this thing up online. We had no idea if anybody was going to use it, but it actually has had quite a bit of uptake. And with the WellSAT 2.0 version, we know that we've had about 13,000 unique users and 23,000 visits, and we've had people from all 50 states use it. And really, we hope that it's been helpful to the districts that have been able to assess their strengths and their areas for improvement. It's also been used by researchers to look at how policies have changed over time. And there have been a few studies that have looked often at particular geographic areas, either a state or a couple of states, where they look at the link between the written policy and then the practices that are being implemented in those schools. We also know of a couple examples of state government agencies that use the WellSAT. In New York, they have a cohort of districts that they support, and they use the WellSAT as one way to provide feedback to the district, as well as an assessment measure that's given at the school level to look at implementation. And then in the state of Arizona, interestingly, they use it as part of their SNAP-Ed assessment. So it's another way that they keep track of how sort of nutrition education has influenced policies at the school level. Next. So as I said, we're updating the WellSAT 3.0. I think maybe you have to continue, and collaborating with Jamie Shrieky and her colleagues at University of Illinois, Chicago. And I just want to sort of walk through the different steps that we went through. So first, we went through the final federal guidance to make sure we captured everything. We looked through the research evidence and best practice guidance. So that led to us either adding or removing some items. We also, and this was really interesting, we went through the items that are also assessed in Jamie's national study, and we kind of looked at things that we've been assessing but just hardly ever show up in policies. So some of those we decided to remove since they really didn't seem to be something that districts were focused on. And then we also did a factor analysis with the data from the national study, which is essentially a way to look at items that are very closely related to each other. And if we have items that essentially seem to be answering the same thing, then we would take out one of them because it's redundant. So that was the next step. Then we did a huge survey to national organizations, work groups, and emails of all the people who had used our tool, and maybe some of you guys filled it out. And we asked each person to rate the item for how important it is, and also to rate what we had considered our 2 score. So, when we're deciding a statement, if a statement sort of qualifies as being kind of a required strong statement, you do have to make a judgment call. And so we wanted to make sure it was sort of like Goldilocks. We wanted to make sure that our statement wasn't sort of too weak, too strong, or if it was just right. And we had 77 people complete that survey last spring, and this is just a breakdown of where everybody came from. And as you can see, the majority were people from school districts, so they were really the users of the tool who, were using it on the ground, which was terrific. We also had a number of people at universities and advocacy groups, and then some government, state and local government, and then a little bit of national government and state and local advocacy. So basically, after that survey, we removed the items that were rated low in importance, and we adjusted that level 2 coding based on feedback. And our final item count was 59. And then we had a couple of researchers go through and code 50 policies that were from the sort of most recent round of the National Wellness Policy Study to establish and rate reliability, and revise their coding guidance, and identified examples for each item. So that was sort of that last process to make sure that the way the questions were being asked made sense to people, that 2 people looking at the same question would kind of get the same answer if they're coding the same policy, and trying to make sure things were as clear as possible. So, so here are just some highlights of changes for those of you who may be familiar with 2.0. So we updated all the items to be consistent with the latest federal regulations, and we actually have a little icon next to the item of like a little tiny capital to show, capital the building, to show if it's one of the federal regulations, and we have quotes so you'll recognize the actual language from the federal rule. There were a bunch of questions that we used to ask, specifically looking at competitive foods. We were very focused on competitive foods. So we had questions about, fat and sodium and sugar and different things like that. But those are really not as important now because of smart snacks. And so we were able to take those out and just make sure that they're implementing smart snacks. And the same thing for the meal nutrition standards. We used to have a lot of items about whether or not the meals were going beyond what at that point had been the nutrition standards. We had asked things about, having fruits and vegetables every day and different things that, we really wanted to encourage that later turned out to be part of the Healthy Hunger Free Kids Act sort of new rules. So those we were able to take out. And then we also added a number of new items specifically about food marketing, since that was a new area. And we added an item about fundraising. Next. So as many of you probably have heard in the news, this issue of feeding children who have unpaid meal balances and the concern about stigma and how to handle all of that. So, that's been an issue, and USDA had put out, a document that sort of discussed the issue and had some best practices. So we had added an item on that. And then there were a couple things really relevant in this space, such as farm to school and CISPAP, the physical activity sort of overview, that instead of asking about those by name, we decided to sort of pull apart the components of them. And so we have a couple of questions about farm to school to really get at the sort of procurement and education, and having a school garden is included in the 2 coding for one of the education items. And then instead of one question for CISPAP, we have one question for each of the components. And then another thing we added, really based on the research showing how important this is an item about school level health advisory teams. So we have an item on the district wellness committee, which of course is required, but also that school level, because that's been shown to be really helpful with implementation. Next. So I put this up just to sort of, I guess, illustrate this idea that I think could be really helpful, which is to really start up at the top of the circle and, use the school health index, and then use the WellSAT. And then sort of having the 2 side by side, it will be interesting to identify what are the practices that you are already implementing in your school, but are not in your policy. And then the idea there would be to go ahead and add them to the written policy, because it's great to have things that are being implemented, but if you really want to make sure they get implemented over time, if there's a change in administration or a change in the champion who maybe is the one who's really helping to implement it, if you put it in the policy, hopefully that'll help it stick. And then at the same time, you can identify policies that are not in practice. And that, interestingly, is not as common as the first one. We've done some studies looking at written policies and implementation, and it's more common for schools to be doing more than is in their policy than the reverse, where they're not doing something that is in their policy. So, but there may be some things that aren't getting implemented, and in that case, you want to certainly identify those and then come up with a plan. And then it's really just a process of repeating that over time, every 3 years, as you're able to update your policy. So that was my last slide. I'm happy to answer questions. This has all my contact information. And just to mention that WellSAT 3.0, we're just kind of going through it with a fine-tooth comb right now to make sure everything is working. And our hope is to launch that by the end of this month. And I did want to invite, if there was anybody who wanted to help test it out, feel free to email me and I can send you the link and you can try out the beta version and let us know how it works. Thank you.
Great, thank you. So we want to do one more poll. I realized also on the last reflection question, you were all typing into the questions feature and I was looking at the chat feature. So I apologize about that, but thanks to those of you who did reflect on how implementation has changed for you over time. It looks like for many of you, it's gotten easier over time. So that's great. So the final poll question now is, has your school used the School Health Index or WellSAT to assess your environments and your policies? So if you have and it was helpful to make changes, go ahead and mark that. Yes, but you haven't acted on the results yet, or no. And we'd like to get a sense of how many of you have been assessing your policies and environments. So that should have popped up and you can fill out the poll. I'll give you just a few more seconds. All right, let's go ahead and close the poll and show the results. So it looks like nearly 70% of you have not used an assessment like School Health Index or WellSAT, and 13% of you have to make positive changes. So we would encourage you to really look at some of those resources and assessment tools that are available and see if you can look at your own policies against those criteria and see if they might help you make improvements over time. So our final speaker today, I'm going to turn it over to Kate Yeager at the Healthy Schools Campaign to talk about integrating health and wellness into the Every Student Succeed Act. And then after she is finished, Sarah will take us through the final reflection and a Q&A session. And of course, we'll have an evaluation for you. So Kate, I will turn it over to you to go into ESSA.
Great, thanks, Jana. So as Jana mentioned, my name is Kate Yeager. I'm the Director of State Policy and Advocacy for Healthy Schools Campaign. We are a national nonprofit organization dedicated to making schools healthier places for all students. So for this last segment, I'm going to talk a little bit about opportunities for student health and wellness under the federal legislation, the Every Student Succeeds Act, affectionately known as ESSA. So I'll walk through a few different pieces, including the state accountability system, state and local report cards, school needs assessments and improvement plans, professional development programs, and then talk a little bit just about some funding and other resources that are available. So state accountability systems serve really as a concrete way to ensure schools that are meeting state benchmarks for the educational attainment of students. So the state accountability system is a set of indicators used to determine school performance. It breaks things into schools and student subgroups, and they're required to meet certain benchmarks. And if they aren't meeting those benchmarks, then they're designated as needing improvement. At that point, LEAs must designate resources to improve outcomes for the schools and or the student groups. What's interesting about ESSA now is that this latest reauthorization offers states more authority over their accountability systems than under previous law. So states have the flexibility to, and many states are, transitioning from systems focused slowly on academic assessments and graduation rates to ones incorporating a broader array of measure of school quality. So that gets into the indicator of school quality or student success. ESSA requires a minimum of one school quality or student success indicator, and many states have chosen more than one. For example, Illinois has chosen chronic absenteeism and school climate and culture. Next slide. So this provides just a summary of the school quality indicators chosen by the states that are related to health and wellness. So an overwhelming majority of 36 states plus DC chose to include chronic absenteeism. 8 chose physical education or fitness, and 6 states chose school climate. And another thing to note here is that this is the first time that all states will be required to officially track chronic absenteeism on their state and local report cards, which we'll talk about in a minute. So it is sort of exciting to see that so many states have actually added this to the accountability system as well. So just to dig into chronic absenteeism a little bit more and how that relates to student health and wellness. So chronic absenteeism is a proven early warning sign of academic risk and school dropout. It's most often defined as missing 10% or more of school days, and it includes absences for any reason, whether it's excused, unexcused, or suspension. And the research shows that student health and school's health and wellness environment are key factors that can contribute to a student being chronically absent. So the causes of chronic absenteeism are multifold. They can include things like transportation, access issues, but student health issues really are a leading factor, and chronic absenteeism serves as a strong health proxy measure. So really this particular measure is powerful in terms of support and implementation of school wellness policies, as things like school breakfast and meals and physical activity are really an important opportunity to link the work around wellness policies to addressing this required measure. So moving on to state and local report cards. So in contrast to the accountability system, state and local report cards are more of a community accountability system that can provide advocates and parents and other interested parties with the information they need to push and advocate for changes, as well as serve as a good interim step for exploring new measures that could eventually be added to the state accountability system in the future. So these, and I think one of the speakers talked about this a little bit earlier, but it's must be widely disseminated to the public in an easy to understand format, especially so that parents and family members can understand the information. And then just so some potential examples of health and wellness report card measures, they can include things like school meal participation rates, minutes of PE offered, PE class size, minutes of physical activity, presence of a school wellness committee, presence of and adherence to a local wellness policy and its requirements, or things like integration of nutrition education into a school's health education standards. So next slide. So the next piece following that is the school needs assessment. So they're really a comprehensive process and focused on the entire school with the purpose of identifying strengths of the current program, but also to identify weaknesses or obstacles and barriers in each area. And really the purpose is to understand the root causes of poor academic performance, and the needs assessments really do need to consider the physical and mental health, hunger, housing stability, safety, and a lot of these other wellness factors as well. And in these assessments, schools can utilize the CDC School Health Index or Healthy Schools Program assessment data as part of the process. So really the opportunity to get involved in the development of school needs assessments can really help ensure that factors such as nutrition education programs, PE, school climate, are examined by the schools in the district as possible ways to improve academic achievement. And it's also a way to increase the number of schools actually implementing these practices, which again goes down the road of making it more feasible to include them on state and local report cards, and then again, ultimately on the accountability system. So I would just add on this one that it's also important to know that all underperforming schools have to conduct needs assessments. And we know just from research that health and wellness issues disproportionately impact students in these communities. So again, it's a really important opportunity to address these areas of high need. So finally, moving into the school improvement plan. So once the school has completed a needs assessment, the next step is to create a school improvement plan, which is formed by the findings from the assessment. So it's really to address the deficiencies identified by the assessment. It's required to incorporate evidence-based practices and should absolutely align with the existing local wellness policy. Again, and it's another opportunity to address all the factors affecting academic performance and looking at things like school breakfast programs. Yeah, okay, so next slide. And then finally, one other piece is really looking at professional development programs and how they can be used to ensure that all teachers and all staff, not just staff focused on health and wellness, but on how all staff in the school understand the impact of health and wellness on their students and how to successfully integrate health and wellness into their interactions with students. These programs should ensure that school staff can attain the goals that have actually been created by the state's accountability systems. And ESSA actually provides specific funding for professional development programs, again, for all staff, including health and wellness staff and support personnel. And I would just note on the funding here that there really is a large amount of flexibility in how it can be applied, so it can serve as a helpful tool and that it can be really tailored specifically to a school's specific needs. So building on that piece, so the three main buckets of funding opportunities under ESSA for health and wellness are in Title I, districts have an opportunity to access these funds for health and wellness as long as these programs are included in their plan. Professional development we just talked about. And then the third piece is Title IV Part A, which are the student support and academic enrichment grants, which authorizes funding in three areas, which are providing students with a well-rounded education, and then in addition, supporting safe and healthy students, which includes things like school mental health, drug and violence prevention, trauma-informed practices, health and physical education. And then the third piece is supporting the effective use of technology, which can be used to support professional development programs. So that's another avenue to get additional funding to support those PD programs. And then here's sort of, I think we've talked a lot about this in the past hour, but opportunities to engage. So the link above, the first link, actually takes you to the ability to track ESSA implementation updates by state. So you can sign up to get updates around ESSA relevant to your state. And then again, just engaging with your Department of Education staff, your state board members, and different staff to stay informed of the various ESSA timelines and dates for your school district. And then really importantly is engaging with local partners. So these can include local hospitals, particularly children's hospitals, community organizations dedicated to supporting children's health, public health agencies or departments, pediatricians, and I recommend your local chapter of the American Academy of Pediatrics, as well as local universities and colleges. So, and then finally, as Beth and some of the other folks mentioned, engaging with your local wellness committee, which pretty much every school should have one if you have a free reduced meal program, but they really play a key role in informing the needs assessments, tracking school health and wellness data, and then informing the actual school nutrition and physical education policies. Next slide. So I won't go through all of this, but this is just a general timeline of key ESSA dates, although each state creates their own process. This is what a typical timeline might look like. I think most important to note here is that ESSA report cards come out shortly this fall, and again, we'll include that chronic absenteeism data. So it would be a great idea for you to go and look up your local school report card and see how you're faring there, and then again, use some of those touch points to interact with your schools and districts to address the health-related causes of that. And then the last slide, really just some other resources about connecting health and wellness through ESSA, through wellness policies, addressing chronic absenteeism. There's a couple different things you can sign up for to receive different updates relating to ESSA. So that is it. So thank you.
Thank you, Kate. All right, now we have another reflection question for you, which is how might you incorporate health and wellness into your local ESSA implementation activities? So we'll give you a minute to go ahead and reflect on that and to type your answer into the chat box. All right, we'll give you another few seconds to type any reflections you'd like to share about incorporating health and wellness into your ESSA implementation activities. In the meantime, while you're typing, we did get a question about the School Health Index website, and that is housed on the Center for Disease Control and Prevention website, and we're going to display that link in just a second. Okay, so with that, we'll move on. Feel free if you're still, oh, I see we have one response, which is bringing new information to the Wellness Policy Committee. Thank you. For time's sake, we will move it along, but feel free if you're still typing your reflections. Still a few more seconds. Okay, so now here is, you can at the top, the web address for the Centers for Disease Control Prevention and a few great resources we want to share with you. So the School Health Index, you can find a link to that and information there. A few other resources put out for the Centers for Disease Control Prevention, putting local school wellness policies into action, stories from school districts and schools. Another one on local school wellness policies, where do they stand and what can you do? And school district wellness policies, where do they stand and what do you need to know? We have a few more CDC resources relating to the WISC model, whole school, whole child, whole community model. And you can see the web link right at the top. So things like an overview, a fact sheet, posters that you could display at your school, a guide on implementation, and then another guide on implementation that's from the National Association for Chronic Disease Directors. Just a little note on the support for this webinar. And with that, we'd like to open it up to a general, I do have one more reflection that I'll just share since it was typed in on integrating health and wellness into ESSA implementation, including community and parent involvement within health and nutrition education and participation. So with that, we will open it up to Q&A. You can use the chat box or you can use the question features. And if our speakers are able to hang on, you can go ahead and unmute yourselves and go ahead and let us know any questions you'd like to run by us. I'll give you a few seconds to do that. Give you about 10 more seconds for any questions you might have for our speakers or for us at IPHI. Okay, so with that, I want to thank you all for joining us, and I want to thank all of our excellent presenters today. A lot of great information. You will receive an evaluation for this webinar. It will automatically pop up once I close it, and it will come through to you in your email as well. And we would love to hear from you and your thoughts on this webinar. And we're always trying to improve our offerings and make them the best they can be. So with that, thank you everyone for joining us. We are offering, as Janice said at the top, a number of other webinars throughout the course of this year, and we hope to have you there, and we look forward to our continuing work with you. Thank you, everyone.